At times, parents question whether their child's speech and language development is on track. In this video, I'm going to mention some of the more common signs of how speech and language delays could present themselves. I'm also going to mention when you should talk to your child's healthcare provider about speech and language development concerns you may notice. Babies start communicating with us long before saying a single word. Your child's cry, smile, and reactions are ways they communicate with you. All children develop at their own individual pace, but there are guidelines we follow that give us an indication whether the child's speech and language development is progressing as expected. A child can have a delay in the development of speech, language, or both. Speech is the verbal expression of language and includes the way we say sounds and words, whereas language is how we understand and are understood by others through our verbal and nonverbal communication. One of the quickest ways that parents notice a speech delay is that their child is not saying as many words as other children their age. It's not until 12 months that we really expect the baby to be able to say a few words. Most babies will be saying mama, dada, and at least one other word. But before that, by the end of 3 months, the baby's speech development includes making cooing sounds like ah, oo, and agu. And by the end of 6 months, babbling using recognizable syllables such as ba, da, ga, and ma. By 15 months, most toddlers are saying at least 3 to 5 words, and by 18 months, between 6 and 20 words. At this age, they will typically say single words instead of putting them together in sentences. By 2 years of age, most children can say at least 50 words. Between 2 and 3 years of age, children have a huge jump in language skills. They expand their vocabulary and start putting together at least 2-word sentences. By 3 years of age, many children are putting together at least 3-word sentences. If a child is not saying as many words for their age as the guidelines recommend, it's an indication for us to look further into whether a delay is present. Another sign of speech delay is when a child can't pronounce words clearly or can't pronounce certain sounds, leading to communication difficulties. Of course, when they're just starting to speak, most of what children say is hard to understand and they will mispronounce words. But at 2 years of age, we expect that about 50% of what the child says should be understood. Around 75% of what the child says should be understood at 3 years of age, and most of what the child says should be understood at 4 years of age, even by people who don't know the child. Some ways that this type of delay may present itself is that the child will omit part of the word, such as saying bow instead of boat, or the child may have difficulty pronouncing certain sounds, commonly the R and S sounds. An example would be a child who says wabbit instead of rabbit. This can also involve the child adding extra sounds in a word or repeating sounds such as saying ba-ba-ba-ball. If a child uses gestures instead of words to communicate or speaks with an unusual pitch or volume, these also may be indications that they have a speech impediment. One of the signs of language delay is when a child struggles to understand and process what is being said to them by others. In this type of situation, the child has difficulty comprehending words and connecting them with ideas. Therefore, the child may have a hard time giving answers to questions or may give answers that seem off. In addition, the child may have trouble following directions that are spoken to them. By 18 months, most children can follow a simple one-step direction. For example, sitting down when told to sit down. At 2 years of age, children should be able to follow simple 2-step directions, such as pick up the ball and bring it to me. When children struggle to achieve this skill set, it may be an indication that there is an underlying language delay. Another sign of language delay is when the child has difficulty using words to communicate needs and ideas. Some of the ways that this can present is that the child struggles to put words together to form sentences. Also, the child may leave words out of the sentences or use the past, present, and future tenses incorrectly. In addition, because of having a hard time finding the right words to say, the child may use a lot of placeholder words such as ah and Another potential sign of delay is that the child doesn't engage with others as much as other children their age. By 1 year of age, it's expected that children will look up at someone when they enter the room. They will wave goodbye when people are leaving. By 2 years of age, children will make eye contact with others to try to get their attention, or point to things they're interested in and want others to look at those things as well. In addition, the child will bring toys and other things to show them to others. Some of the ways that this delay may present itself is that the child will show a lack of interest in others or is not making good eye contact. The child will prefer to play alone and seems to tune others out. These children tend to get labeled as shy, but it's important to get them evaluated to make sure that a delay isn't overlooked. Now let's talk about when you should raise a concern about your child's development. If at the following age marks you notice the red flags that I mentioned, you should speak with a healthcare provider about your child's speech and language development to see if further evaluation is needed. In the first several weeks of life, your baby doesn't get startled by loud sounds. By 3 months, your baby doesn't seem to recognize and turn towards your voice. By 6 months, your baby is not turning the eyes or head towards different sounds in their environment, or your child is not babbling. By 12 months, your baby is not saying mama, dada, and at least one other word. Or the child does not wave bye or make other gestures when interacting with others. By 18 months, your child has trouble understanding and following simple directions, prefers to use gestures to communicate over vocalizations, or is not saying at least 6 words. Or your child doesn't seem to notice when you're in the room and seems to tune others out. By 2 years, your child doesn't say at least 50 words, only says several sounds or words repeatedly, and can't use language to communicate more than immediate needs. Or if your child can't follow simple directions or has an unusual tone of voice that sounds raspy or nasal sounding. By 3 years, if your child is not putting together at least 3-word sentences or others can't understand at least 75% of what the child is saying. By 4 years of age, if people don't understand most of what your child says, or the child struggles to understand questions or give appropriate responses to questions. Keep in mind that each child develops at an individual pace, and some children do take a little longer to meet certain developmental milestones. However, if you notice any of the things that I mentioned in this video, it may be a sign that the child has a delay. By discussing it with your child's healthcare provider, it will allow them to decide if further evaluation is needed or if it's something they can follow more closely and give the child more time to develop. See you in the next video.